Good morning, everyone. My name is Hector Basham. Back in 2024, I was diagnosed with salivary gland stage 4 cancer. I didn't choose cancer. I didn't choose to become a cancer patient. But I will say this, if you're gonna face a life-changing situation, you might as well do it with faith, with a little bit of sass, and with good hair. And I'm glad I have mine back. Jokes aside, so let's get started here. We have some housekeeping items we need to get through. I have no conflict of interest to disclose. Discussions include off-label, holistic therapies, and part of my patient experience. So some of the things I intend to get to you today is basically take a look at the clinical and psychological journey based on my perspective and my experience of a rare head and neck stage 4 metastatic cancer. Also, I want to give you my perspective on some things that I identified through the process of my treatment, such as empathy, communication, and survivorship care. Also, I warn you, I'm Puerto Rican, so I have a heavy accent, so I apologize for that. I also want to talk about my patient-centered perspective in hopes to improve the oncology practice, and also to emphasize the importance of the multidisciplinary excellence and hope in treatment outcomes. And to me, this is important because in my scenario, in my experience, multidisciplinary excellence saved my life. These are some of the learning objectives and things that I would like for you to take with you once I'm done with my portion. So here's my story. Back in 2015, who is now my wife, noticed a lump on the right side of my neck. It was very small, smaller than the size of a pebble. Back then, I went ahead and got it looked at by my primary care at that point, and he actually wanted me to get a CT scan done. And the diagnosis at that time was that it was benign. It remained stable for 8 to 9 years approximately, before any malignancy progression showed up. You can see here the low T treatment in November 2024, and I'd like to talk a little bit about that. I had a very high stress level job. I was working for the Department of Homeland Security. I had a law enforcement military type job, and I had a lot of responsibility. And I was feeling very fatigued, which was very uncommon for me. And the stress level in my job has spiked a little bit, so I went ahead and got a physical. And with that physical, they checked my testosterone level. Happened to be low at the time, so I agreed to do a low dose of testosterone treatment. And I think this is important, even though to this day, I don't know what exactly caused my cancer. There were, I think, different reasons or things that transpired that maybe contributed to that. But I think that the patient perspective carries data, and I feel like this was big in my cancer, because from that time, that first injection to the tumor starting to grow out of proportion was like literally within a month. So with this, long-term dormancy did not prevent it, subsequent malignancy progression. And one thing here is that, and if you ask me, what would you do different? This is one of those things that I would have done different. I wouldn't, for those 8 years, I didn't went and got that nodule rechecked, okay? So I think long-term awareness is important when something like this comes to play. So the symptoms I felt prior to the diagnosis, I had acute, very abnormal headaches. I have headaches before, but this type of headache was throbbing, but was different in intensity as well as length and the frequency of it. I had recurrent nosebleeds. The dizziness was very common at that point. I'm talking from November, from the low T treatment to December. I was constantly dizzy. And then certainly, like I mentioned priorly, the fatigue was also there. These are some pictures, so that way you can see the timeline. You see there on my left, actually your left too, 2015, that's what it looked like when it was first noted on my neck. Then going forward to 2018, as you can see there was not much change from one to the other. And then that last picture was 4 days prior to my surgery. So certainly the shift in growth wasn't gradual. It was very quick, very abrupt, and certainly was alarming for me and for my family. This slide here, I think is important because 6 months prior to my diagnosis, I was living in a different city, and I had just recently been transferred 6 months prior to my diagnosis. So geography for me was a major issue and very important, and as well as the referral network, and I'll talk a little bit more about that in future slides. Same thing with the centralized expertise, improve outcome. Also, it was a blessing to me that I had very good and reliable health insurance, and it certainly had an impact on my treatment. And it goes without saying that rare cancers certainly demand a coordinated system of care. The communicated risk prior to my surgery were this, I knew, and my surgeon who's here, sitting with me here today, communicated that, it was gonna be a long procedure. The biggest concern for me was the mention that I would probably lose the functionality of my facial nerve because my tumor was right on my facial nerve. So that created a lot of concerns for me because of my type of job at the time. I was a pilot. I didn't want to lose my FAA medical certificate and subsequently my job. So that was very concerning to me. And again, just the possibilities for facial impairment was a concern. So here are the outcomes of my surgery and my intervention. Certainly the tumor was successfully removed, as well as some compromised lymph node that they found during the surgery. I believe there were 3 or 4. My ambulation was in 3 days. I was discharged in 7 days. And this was a big one for me, preserved speech with limited functionality of my face. Subsequent to the surgery, I did experience facial palsy on the right side of my face. Despite the initial expectations, I went in there thinking that I was gonna lose it all, and came out of there because of the great work of my surgeons and my clinicians with some functionality on my face. And I also left the operating room and went home with complete hearing loss on my right side. So on paper, certainly this looks like a very successful surgery. And it did. It was an excellent outcome based on the expectations, initial expectations going in there. However, from the patient's perspective, survival statistics, they do not measure what it feels like to have to relearn your face, to have to relearn the functionality of your facial expressions. Same thing with your hearing. Now having to learn how to miss half of a conversation was very psychologically hard and emotionally for me. Subsequent to my surgery, we started, a couple of months later, we started radiation on a daily basis. There were a total of 33 radiation cycles and high-dose cisplatin. And that was being administered once a week. That led to severe fatigue, and this is the type of fatigue that sleep doesn't take care of it. I also had a lot of mouth sores and infections on my mouth, which prevented me from eating, swallowing, lost close to 78 pounds in that process. Started losing my hair, which is important to me. And then something transpired with that first medical oncologist that I had in one of, I want to say, the second to third week or cycle. I wasn't getting better, things were going south, and she made this statement: if treatment does not work, there's nothing else we will be able to do for you as far as science is concerned, but however, we'll keep treating you. The treatment certainly attacked my cancer, but I can tell you that these words certainly attacked my hope. I was hoping to hear at least a Rocky soundtrack and getting me pumped up. However, this is what I got. And this was very, very, not only hard on me, but also on my wife, who was there with me that day. Subsequent to these cycles and this type, the phase 1 of the treatment, you oftentimes hear, "Oh, you look great given the circumstances of what you're going through." Oop, I don't know what's going on here. Sorry. And they may be right, and that may be the outlook, clinically speaking, but my reality was that I was learning literally to live in a different body and with a different me. Psychologically, emotionally, that was really hard. As I mentioned earlier, radiation certainly had a major psychological impact in myself. The first surprise to me was to learn that I had to wear an immobilization mask. Not only when I learned it, but when I had to use it the first time, certainly created a lot of anxiety. And not knowing that beforehand, I think was what really spiked up the level of anxiety that I felt. It also made me feel isolated, given the fact that radiation was on a daily basis, it was repetitive, and certainly once you go into that room, there's this sense of loneliness with the process. And there was certainly compounded psychological stress. And stress is something that accumulates very quietly, especially for me, my cancer patient perspective. And it's something that is very unnoticed because, when people look at you, you look fine, but the reality is that stress is building up. And it certainly had an impact on myself. Certainly, I experienced mental fatigue and myself, but also my caregiver. People look at the cancer patient and what we go through, but I can tell you that they are that silence patient. I honestly, without the great work of my clinical staff, my surgeon, but also the care of my wife, who's here with me today, I don't think I would be here speaking to you today. Um, Thank you. Certainly, the exhaustion was parallel and it was shared, not just on myself, but also on her. Um, I don't know how you did it. I don't know how you did it. Throughout this process, I was still working remotely, even though I had, like I mentioned, a law enforcement job, but I was one of the directors for Homeland Security at that point. They were kind enough to transfer me on paper to Washington, D.C., but I was working from my home. I am hard-headed. I decided I cannot stand still, and I didn't want this illness to put me down, and I wanted to feel purpose. I decided to take on a second degree, which I'm about to finish. Don't ask me how I did it. Sometimes I was like, why am I doing, God? But it gave me purpose, even in the hospital rooms, getting blood transfusion, being in there with my computer, and being that example to other cancer patients that I met along the way, great people. Just being able to at least be hope to them. Hey, if he's doing it, I can also do it. So that was very important to me through this process. So this is the disease progression of my cancer. After that first phase, they did a PET scan to learn that the treatment did not work, and it had metastasized through my liver, lungs, the pelvic region, and it escalated very rapidly. I experienced acute sharp pain in the pelvic area. The fatigue was there. I blacked out, I want to say 3 or 4 times through that process. And I started noticing a lot of bleeding in my stool at that point. But then something happened. I got a referral to a new medical oncologist, which was a blessing. So the referral network certainly works, and he incorporated a different type of treatment. We went from radiation to carboplatin. I forgot the other one, and then Keytruda came into the process, Pembro, which was a blessing. And for those of you that are here and had your hands in developing that drug, I cannot thank you enough, because thanks to it, I'm here in front of you today. And that was incorporated with functional treatment. I started doing ozone treatments, high-dose vitamin C infusions. I started taking ivermectin and fenbendazole. And I can tell you, from the day I started those two things, Pembro and this, 2 weeks beyond that, I just was a different person. I want to emphasize here on the gaps in research. And certainly, I think research and the creation of Pembro is something that was critical in me, in my treatment, and me being here today. But we know that there is cancer data scarcity, especially with rare cancers like mine. Certainly funding is an issue for that. And there are not enough participants. So that's why it's an honor for me to be here today sharing my story. And hopefully that you guys can take it and help some other people. But one thing I want to emphasize here is the mental health outcome with cancer, which is huge, right? If I did not have that resiliency, that drive, stubbornness, for lack of better terms, I thought that military training was gonna get me ready for the things that I faced when I was out there. Honestly, I was wrong. I learned that this was my biggest battle and my biggest engagement. And thanks to that, I had that resiliency to fight through this. However, I still don't know the main cause, what really caused my cancer, and to me that's concerning because I have children. I want to know what caused it, to be aware, for my kids. And I think that's huge for people that are going through this process. So things that I want you to take away with you today, and it was in my case, rare cancer certainly needed a centralized expertise, and I was divine appointment that I had just recently transferred to the Indiana area, where I was able to get connected with Dr. Moore and the IU Health Network. Empathy really matters. Empathy really matters. Not only from the staff, but also from the provider standpoint. And competency and effective communication. And that's one thing that I have to really thank Dr. Moore because your communication was very concise. And you and Dr. Dorm, your competency certainly have me here today. And like I mentioned earlier, patient's narrative carries data. But the one thing that really sustained me through my process was my faith. I'm a big believer in God. And that was that verse right there, John 11:40, really kept me going and moving forward. And I want to leave you with a quote from, I don't know if there's any baseball fans here, the great Roberto Clemente. At one point he said, he was interviewed and he said, if you have the opportunity to help somebody or change someone's life and you fail to do that, you're wasting your time on this earth. And Dr. Dorm, I want to thank you because you were that person to me. You had the opportunity to help and change somebody's life. Not only you changed my life and kept me alive, but also we were impactful on my family. So thank you, sir.